Hi, this video is the before and after hair transplant restoration surgery on a client who had advanced hair loss pattern, and we basically, he's thinning from the front all the way to the back, and his hair not only receding up but his temple's gone back all the way here. So we rebuilt the temple, and I just want to show the audience that we brought in like an inch and a half on both sides, but the way I do it is very natural without much detectability. And when you look at the client, you cannot tell he have had any surgery done, especially the temple hair. And not just the temple hair, but the overall. And look at that, it looks fantastic. So I'm going to show the audience what he looked like before. Okay, and so that's why now, and we're going to show the audience what he was before. So, and this is, he had a procedure done before too with this one. But the angle here is all over the place, and poor density. And that's before, and this is afterward. Very nice. I rebuilt his hairline and clean it up, make it more natural. And on the right hand side, you see how all thin here, but the temple gone back at least an inch and a half, an inch, and we brought it all the way forward. You see how natural the temple, we brought it from here all the way in, and increase the density and allow him to wear his hair longer. And again, his hair is thinning here and all completely bald there. We completely rebuilt it. It looks nice, excellent density. And you can see the magnitude how thin his hair from toe to back. And that's afterward. Before, after, before, and after. And again, before, and that's the left hand side, the temple. It has nice volume. Before he couldn't really wear his hair long because on the top is very thin, and if you grow it out, on the side thick, but the top it doesn't grow out that long. Again, that's before. Okay, and this is where he is right now. He looks fantastic. Actually, we almost, the whole clinic didn't recognize him, and such a subtle change in terms of the hairline and the temple completely changed the person's face. And this is an art form. It requires a lot of the artistic and aesthetic detail. So that's this side. We can have him turn this side, and then turn his head this way. And you can see how excellent his temple is. And then turn this front view, and I'll have him look down. That's where his hair is now. Excellent hair. And see how natural. And you know, there's quite a bit, especially when you talk about the temple, you have to be careful if the surgeon experienced it or not, because quite often I have to fix it. The temple hair is mostly root to go single hair. Rarely it has two, and the angle is really flat against skin, fall backward. There's a couple of clients where I come in and I have to fix it. They would transplant with thick roots, so it looks very harsh and doesn't look natural, and the hair angle is still flat and pointed backward down. It actually points straight perpendicular, and then it looks like, you know, a salamander looking like. But that's, you have to be really extra careful when we talk about the temple hair. So that's where he is. Thank you. And that's where he is now.